A reminder that we will be recording the session today, and that'll be available on the internet afterwards for anybody who wasn't able to take time today to join us. So if you could press record, that would be wonderful. As always, comments and questions in the chat, please, and we'll collate them, answer them as we can, if we can go through the chat, and if not, we'll address them at the end. We really do value it when people do engage with us, and we want to hear your views and thoughts and questions, so please do pop those in the chat should anybody have any of them. And hopefully many of you on this call will be looking forward to some a well-deserved break for at least part of, if not all of, the Easter holiday coming up. So we've got that to look forward to in the week ahead, and lots of preparations that are happening. Today's egg collection day for the Children's Hospital, so the drop-off day for our corporate donors of Easter eggs is today, so hopefully the place to be will be bursting at the seams by the end of today with chocolate, which is the aim. Okie dokie then. So if we begin by talking through the highlights from Tactical on Friday. So it was fed back that it's now very difficult to assess the community rates of COVID due to the lack of community testing. And that obviously impacts on when we're trying to predict and manage patient flow and capacity. But we will try and continue to try our best with the information that we have. Currently, there's 173 COVID positive patients in the bed base, and that's a static position of the past week. But the prediction is that will increase slightly to about 188 for this week that we're in currently. Again, it's the lack of community testing that's affecting the accuracy of the modelling, so it's not quite as accurate as it used to be, but it does give us an indication. Currently 5 red wards open across LTHT with the option to increase as and when required. In terms of IPC, the COVID scorecard has been remodelled. Again, that's due to the lack of the community data that's available. And the nosocomial transmission looks to be between 15 and 25%. So again, that looks to be reducing, if not staying at the same levels, but certainly not increasing at this moment in time. There was new guidance issued on the 31st of March regarding high-risk contacts and the eligibility to ask PCR and community treatment, but Celia is going to talk much more in detail about the change in guidance and the swabbing guidance as it pertains to children's services when we get on to that bit. In terms of the core principles that we're being asked to maintain as employees of LTHT, that maintains virtual meetings where they are possible, and the 2 metre social distancing, etc. It will be staying in the trust, but will be reviewed at the end of April. And the requested people be patient, because we know that it is very difficult when out and about, life is returned to normal, as we may have known it before the pandemic, and when you're coming to work it's very different. But they've requested people be patient due to the transmission being so high at the moment, but it will get better and things will change, and we will pick that up and change accordingly. But the end of April is when that is being reviewed. And then one of the groups, as part of the transformation where the outpatient group fed back, the removal of all self-checking kiosks is happening across the trust. Reason being that they're old and they're costly. This is in outpatient areas and need upgrades, and only 20% of patients actually use them. And there'll be some more detailed work going into the PAS handbook for training administrative staff across the trust as well, which hopefully will help improve the speed and efficiency and reduce the number of errors that are experienced within admin due to human error in the main when booking and rebooking and cancelling outpatient appointments. So that was everything from Tactical. And if I pass over to Celia for an update on what was discussed at Bronze and swabbing. That's okay.
Thanks very much, Suzanne. Good morning, everybody. I'm Celia Mackenzie, Head of Nursing at the Children's Hospital, for those of you that don't know me. So the things we talked about at Bronze last week were really the swabbing of parents, the swabbing of our patients, particularly those out of area, and also we talked about any sort of releasing of restrictions for parents and siblings so that we can allow more people in. We've heard from the Children's Heart Surgery Fund and also from neonates who would like us to review our current visiting policy. So we have an extraordinary bronze meeting this Wednesday to go through that, because we recognise a number of people are not around, key people not around on a Monday. So we are looking at that. We are hearing what people are saying to us and what they're requesting. As an organisation, and all organisations across the NHS, we're moving away from PCR swabbing, so that won't be available either for our parents or our staff. And there is a little bit of nervousness about not swabbing parents, because they come onto the ward, they move around the ward as well, whereas in the adult world, if they're visiting, they've got a mask on at all times and they're sat by the bed of the patient that they've come to see. We will be moving to lateral flow tests, and currently the organisation's kind of working what that's going to look like. We did put a paper forward to operational IPC for our out of area patients where they can't get a swab done locally prior to coming in for elective surgery or elective admission. So those patients are being advised to go onto the NHS site to get a lateral flow test kit, and you can just tick a box that says you're coming in to hospital for a procedure. If they don't get that, we're currently offering point of care testing. This is all changing and it'll be totally different next week. We're expecting some further information to come out by the end of this week to be clearer on that. But currently, for our out of areas patients, if they're not able to get a lateral flow test, then we're point of care testing them on the day of admission. And then if they have got a lateral flow test, we're asking them to take a picture of the result. And then when they're admitted, we're adding that to PPM. So there's a lot of concern about how we record that and how there's no national recording mechanism, particularly for our patients that are coming in. And we're not sure what that's going to look like going forward. For staff, from a swabbing perspective, new information came out last week. I'm not going to go through it all in great detail, but it did come out in the bulletins. If anybody thinks they haven't got it, haven't seen it, would you please let me know, and we can forward it to you. But it's very clear flow chart. But basically, we're going back to lateral flow, no PCR testing, and there's clear flow chart for if you have symptoms, if you've got contact, or what we should all be doing is testing ourselves twice a week. Very easy to get lateral flow kits. I've managed to do that. You just tick that you work for the NHS and it's required for your job. So there's no charge for the lateral flow kit. But any problems, just come back to me directly. And the other thing that we've talked about with the IPC is the move from for social distancing. So we are expected to be able to move to 1 metre plus, which will be able to put us back all our beds except for one, which will have a massive impact on our capacity and our positive impact on patient flows. But we're waiting to hear about that. So lots of things going on in the background with things ever changing, and we'll make sure that keep your eye on the operational bulletins that come out frequently throughout the week. And then our operational pressures for last week and the weeks going forward. The main pressures, I would say, would be our critical care beds. We're still seeing a high level of quite sick patients. We unfortunately had a patient that had a prolonged period of stay within the paediatric ED department in Resus over the weekend because they really needed an HDU and ICU bed and we didn't have one. Thankfully doing really well now, and Mum was very grateful for the care that she'd received. So managing PICU beds and HDU beds on a daily basis, and we're just not getting an awful lot of movement out of there. And then the other significant thing is the spike that's being seen nationally in children under the age of 5, but actually that age range has increased to under the age of 10, of children with hepatitis, and then going on to have liver failure. The liver team managing most of those patients within the District General Hospital, but a considerable number have had to come across to Leeds. There are 3 liver centres, so we're working very closely together and also working with NHSE, because that is a great concern. There's not really a reason for it, and so we're just treating the symptoms as they are. But again, that will be putting pressure on our critical care and HDU beds too. And that's everything from me for now. Suzanne, back to you.
Thanks, Celia. So we just give you a quick update on finance. So we resubmitted our second forecast at the end of March, which reduced our gap. So our gap was really quite significant, but as it stands today, the gap stands at, in best case scenario, we were at 1.5 million, which is reduced now to 1 million. And mid-case scenario, we were at 3 million, which is now reduced to 2.5 million. So that's the gap away from where we need to be, how much in the red we are. We are meeting with Simon Worthington, the Director of Finance, tomorrow night to go through our position. I will let you know if anything changes following that. We are still, there's a couple of issues still outstanding, which hopefully we will work through and have a much more concrete idea of where we are, but still lots of work to do. The absolute message to take home is that waste reduction is how we get out of this, and waste reduction is how we close that gap and then are able, in a financial sustainable position, to reinvest in our services and do all the wonderful things this year or similar things that we did last year. And we circulated the infographic which really detailed nicely all of that. So on that note, in terms of waste reduction, I'll introduce Liz, who is going to describe to you some of the waste reduction work that's happening within the Children's Hospital. Liz.
Morning everyone, I'm Liz Smith, Business Manager in the Quality Improvement and Waste Reduction team. And last week I gave an example of pathway improvement work that been undertaken by the allergy team. And this week I'm going to share another great example of pathway improvement work, this time from the endocrinology nurse specialist team. So the team reviewed the pathway for a procedure called the HCG stimulation test. They see about 1 patient a month for this test, and the pathway involved admission to the medical day case unit on ward 49 on day 1 and day 4 of the test, so 2 day case admissions for this test per patient. So the team looked at how they could improve and streamline this pathway for patients, and as a result they've started to deliver it through an outpatient clinic instead. So this has streamlined the process for staff and families, and it's resulted in releasing an additional 24 medical day case beds for patients to go through ward 49 each year. So some of you will probably think 24 day case admissions isn't very much over the course of a year, but every avoided admission or reduction in length of stay is really important, and especially for the families it usually improves their experience. And for us, it releases much needed capacity for other patients. And lots of small changes add up and result in significant benefits. And we've got lots of examples of these changes that impact just a small group of patients, but collectively they really help us in releasing some capacity. So as always, please let us know about any pathway changes you're thinking about or have implemented. And thank you very much to Paul Carruthers for letting us know about this great piece of work. And if you want any more information on this example, please contact Paul. Thank you.
Thanks, Liz. That's fantastic, and it really is a good example of some of the wonderful work that's going on. And if there is work similar to that, or anything that is creating efficiencies, be that time, not necessarily just money, but anything like that, then do make sure Liz is made aware, because we want to capture all of these and be able to celebrate them and be able to shine a light on all this fantastic work. And the Children's Hospital is a big place, and we're not always aware of everything that's going on. So please do make sure that Liz and Kirsty are cited on that, so we all are. That's great. Thank you, Liz. Okie dokie. So we're going to go on now and combine our lessons learned with sharing success, really, and hopefully Leanne's on the call. Leanne's going to talk to us about our new outreach service, which was launched last week, which is utterly fabulous. And this has come about through a variety of things, but mainly listening to feedback from our clinicians and learning from incidents has created or highlighted and shone a light on the need for having an outreach team within the Children's Hospital, and we managed to secure funding for 12 months for that team that started last week. And Leanne, can I pass over to you to be able to let everybody know the fantastic service that we're now able to offer? Thank you.
Yeah, hi. Hi everyone, I'm Leanne Lane, I'm the new lead nurse for the Lions team, and as Suzanne just said, we started last week. We're the Leeds inpatient outreach nursing service. So we're a team of experienced paediatric nurses, and our role is to help support all the staff within the Children's Hospital in caring for deteriorating patients. We also review all the critical care step downs, and we also attend all the emergency calls within the hospital, within the Children's Hospital. So as you said, we started last week. We had a very busy week, and the beginning of this week is already starting to be quite busy as well. So I think you'll start to see a lot of us out there on the wards, and I think the feedback's been really positive so far. So we're really, really proud of that. We're covering all the inpatient bed base. So that currently means we don't cover neonates, critical care or the emergency department, but all the other ward areas we will cover, and we'll help with all the patients in those areas. At the moment, the hours from this week are Monday to Sunday, 7:15 in the morning till 7:45 at night, and that gives us 2 staff per shift. And then from the 2nd of May, we'll be going to a 24-hour, 7-day service with 1 staff member per shift. There's been a bit in the buzz already and on start of the week, so hopefully a few of you have seen a bit of information, but we do have a website as well, and we've got a mobile phone you can get the details from. If you just type into Ava Lions, and our contact details come up, and we're on the bleep number 2040. Lots of posters will be coming soon, they're on order, so hopefully we'll get those out and about around the hospital, and you'll see a bit more of those. But if anyone's got any questions, I'm happy to be contacted to answer any of those. That's it, thank you.
Thank you, Leanne. That's absolutely fantastic, and the posters are looking great. I think they got signed off on Friday, didn't they? So they'll be coming. You read my mind.
There we go.
So they're just absolutely fantastic, and I think they get the message across really well. It's such a valuable service, and one that people have been asking about for a very, very long time. So it's absolutely fantastic that we're able to implement this now and give it a go and see how we get on. And I think you're nice and busy already, so that's absolutely fantastic in the way that we want it. So thank you, and we'll keep everyone posted on how it's going. But that's a really, really positive thing to be able to brief everybody at the beginning of the week.
Thank you, everyone.
Thanks, Leanne. Thank you. Okay, so I think we're on to any other business now. And Lisa, are you going to just update everybody on our Easter campaign?
Yeah, no problem, Suzanne. So as Suzanne's explained, it's the drop-off day today. So we're hopefully getting plenty of Easter eggs in, and we'll be getting those out from about Wednesday, Thursday. I've also got play staff working over the Easter weekend, so we'll make sure that there's lots of eggs and Easter activities taking part on the wards, and obviously get where we can eggs to outpatients. So thank you, everybody.
Lovely. And there's lots of things coming in as well that aren't necessarily chocolate related for those children who can't partake. There's crafts and all of the lovely nice things that we can give out to those children, so that's fantastic. So just to give everybody a bit of a heads up again about the Time to Shine nominations, and closing date is the 15th of April, so please do make sure that we put in nominations. We've time carved out as a management team tomorrow to go through that and make sure that we submit as many worthy nominations as we possibly can. As I said, we want to get loads into the Children's Hospital because our staff are the best, and that's as simple as it is. And then just to flag up that there will be no Muddle next week because it is Easter Monday, so just to flag that as well. Is there any other business from anyone else? I don't think there was. And is there anything in the chat, Ed, that we need to pick up?
We had one question from Sean, Suzanne, just around we don't need rapid tests for other viruses because they're not good enough. Why is that different for SARS-CoV-2? I don't know whether we can take that today or whether we need to take it out. for another
Yeah,
conversation?
I think that's a question for the IPC team, but I think it's an NHS directive. So we'll be discussing all things swabbing on Wednesday at Bronze. So hopefully Sean's able to be there.
That's great. And we had another question about access cards, but Celia has taken that. I think that's dealt with. And Rochelle has just mentioned in the chat, of course, Passover starts on Friday. So we may need to think about our Jewish patients and any special food requirements they might have. So it's just one to be aware of, I think.
Thanks, Rochelle. And I'm sure the wards are well rehearsed in that, Celia, in terms of ensuring the dietary requirements are met.
And also just remembering that Ramadan still continues until the beginning of May, and being flexible to our families that are wanting to break fast with them as a family within the hospital, which I know everybody does do.
Yeah, just fantastic. Lots going on. Okie dokie then. Well, thank you ever so much, everybody, for taking the time to join us this morning. If you do have time off over Easter, please do enjoy that special time with friends and family, and we'll see you all when we get back then. Thanks, everybody. Have a lovely week. Bye.
Thank you.
Thank you.